breast preservation or subfascial breast augmentation. Breast preservation. Maybe we should be calling it breast preservation or even chest wall preservation. So what's happening now is there's more of a trend to put implants on top of the muscle under a thin tissue plane called your fascia. So if we look at some anatomy, and here's the breast tissue, here's the pec muscle, this red tissue here, and then this is the chest cavity. Well, in front of the muscle, there's this thin white line. That represents the fascia, which is a very strong, thin tissue that covers all muscle. Well, we can put implants here on top of the muscle, or we could put implants under the muscle. Now, you can see it's under the pec major muscle. Now here, this is on top of the muscle, but this one shows it on top of that white line, which is the fascia. So now we're doing more and more breast augmentations. We're putting it under this layer of tissue. So it's called a subfascial breast augmentation. And what that does, it actually preserves the pec muscle. So you won't see any animation deformity when you're doing your activities or exercising because the implant's on top of the muscle and not subjected to the contraction of the muscle. Also, your recovery is going to be much quicker because we don't have to cut the muscle or create a pocket under the muscle. So that is what we mean by breast preservation or tissue preservation. Now, it's also going to maintain your strength and your shoulder strength long term because we're not injuring the muscle. So there's a number of benefits to going back on top of the muscle in that subfascial plane. Traditionally, we would go under the muscle because many years ago we were using a lot of saline implants. And so we needed more coverage to kind of camouflage those saline implants, which rippled more and didn't feel as natural. Now we have much better implants, much better cohesive or gummy bear silicone implants that we can put either under the muscle or in a subfascial plane.